not only come out, but bring their kids and bring their family.
It is. An important thing to know about this is that the majority of events are free, and many are outside.
Wonderful, wonderful.
So, so there are few obstacles in terms of price, and it really is intended to be family friendly, to introduce your kids to the arts, and in a way that they've never seen before. A lot of adults have never seen the kind of things that we're doing.
Well, I was just going to ask you, and you might have just answered it, how people can get tickets, how much it costs, but you said it's free. Parts of it.
Most of the things are free. So we do have a great website, charlotteartsfest.com. Go to look at that. You can come to the Blumenthal site. You're going to be hearing more and more about this as it launches on September 16.
Okay, perfect. Tom, thank you so much for being with us today. We really appreciate it. We can't wait for this event to take off. So again, like Tom said, for more information, the Charlotte Arts Festival takes place September 16th through October 2nd. And yeah, we'll have all the information on our website as well, wcnc.com. Tom, thank you. Ben?
Sounds like a lot of fun.
Yeah.
When it comes to WCNC's chief meteorologist Brad Panovich, our viewers tell the whole story.
Hey, if you're new to the area, this meteorologist is awesome.
I always stick with Brad Panovich when it comes to severe weather. He's rarely wrong.
You should follow Brad if you don't already. He's usually right on the money with his forecast.
I don't look at anything else besides what Brad says. We are fortunate to have him here.
Brad Panovich. Experience the difference with WCNC Charlotte weather.
Data safety top of mind.
Data to date, Mecklenburg County as of today is reporting 115 cases of monkeypox. North Carolina, the state of North Carolina reported 250 cases as of yesterday. We are continuing to see a majority of our cases being male, and over 80% of those cases are African American or Black males. In addition to that, one thing that's new that we wanted to draw attention to and we're still looking into is that we were able to identify at least 6 of our cases having experienced hospitalization. And we are still not reporting any deaths connected to the current outbreak.
Perfect. Thanks, Joy. Well, I think as most people know, we had a fairly exciting weekend here in Mecklenburg County as we celebrated Charlotte Pride and had a lot of activity happening relative to monkeypox during that celebration. This weekend, our team vaccinated roughly 540 individuals who met the current high-risk eligibility criteria here in North Carolina, bringing our total administered here in Mecklenburg County to roughly 3,300. I am very proud of our team's efforts this weekend to reach the most at-risk residents by simply meeting people where they are. I want to especially acknowledge our Deputy Health Director, Paige Bennett, as well as our Assistant Health Directors, Angela Lee and Glenda Dancy, for their leadership of various aspects of this weekend's response, as well as all of our public health staff, clinical and non-clinical, who served at all hours this weekend to make sure that we had a vaccine available where people were. It was truly a team effort to quickly mobilize, to be strategic in our approach, pivoting to the intradermal injection route, as well as ensuring that we offered care to patients in a manner that was respectful and also focused on those who needed the services and care the most without exacerbating stigma. This is really the work of public health, and I think our community should feel really proud of the work that happened this weekend here. I'm so grateful to Clark and the leadership of Charlotte Pride for embracing public health in the celebration and being proactive in their efforts to keep all of our residents safe, and really appreciate the partnership. This weekend, with the support of North Carolina and the CDC as partners and as a first run for the new federal initiative that focuses on special events, we offered vaccines at Charlotte Pride Festival on Saturday and Sunday. We were also present on site at Scorpio's nightclub, the Woodshed, and Club 321 in partnership with their ownership and several local Black and Brown LGBTQ party promoters. I want to thank all of them for their support and partnership because without them, certainly I know that this weekend would not have been the success that it was, as well as I want to thank our partners at RAIN for their ongoing partnership with monkeypox response and for offering HIV testing throughout the weekend. It really was a community-wide effort, and I want to just elevate and lift up those entities and partners because Mecklenburg County Public Health couldn't do it by ourselves. All these efforts, us being out at clubs in the evening time and the work we did at the celebration on Saturday and Sunday, are critical for us working to close racial gaps in vaccine uptake. And I believe they were successful. About 46% of those vaccinated this weekend were white, non-Hispanic, about 40% were Black or African American, and roughly 11% were Hispanic. This represents a notable improvement to our overall vaccine demographics since we started vaccinating back in July, which were closer to roughly 50% white, about a third Black. And this is health equity in action. And so the efforts that we're taking now, as well as what we're taking over the next several days and weeks, we hope to close these gaps even further. I will tell you that the racial demographics or distribution of races were much greater for Black and African Americans at several of the alternative events, and so we know the strategy is working, and so we've just got to keep it up so we can close these gaps. I think the importance of this federal push for these large events is also really important and should be noted. I know they're going to be doing more of this over the next few weeks and months, and I think it's critical to our national response. This weekend, we in Mecklenburg vaccinated residents from as far as California, Colorado, Oklahoma, Illinois, Wisconsin, West Virginia, New Jersey, Virginia, Georgia, South Carolina, many from Florida, and of course, throughout the entire state of North Carolina. While we didn't use the full 2,000 doses that were available, I think our reach is to be commended. So what's next? We're down to about 660 folks on the wait list here in Mecklenburg County and surrounding counties. We expect to be able to offer appointments to all of those individuals this week. We also have several hundred second dose appointments scheduled throughout this week and throughout the next coming weeks we have for second doses. And we do have more events, weekend events on the horizon. As Joy mentioned, Joy probably hasn't, she didn't mention it yet, but we have had more than 100 confirmed exposures in Mecklenburg County, meaning people who were exposed to individuals who were actively infected. Many of these folks were household contacts and family contacts and were not sexual contacts. And it's really important and underscores the critical nature of what we're doing right now to act quickly, strategically, and equitably to contain the outbreak, and not just contain it, but to end it. We have more work to do, but I'm very, very happy and proud to be a part of the team getting it done here in Mecklenburg County. So with that, I'm happy to take any questions. Bill, if we have folks in queue.
Yes, sir. First question is Lowell Rose, WBTV.
Hi, Dr. Washington, some WBTV. My question actually is more on the side of things. Working on a story talking about the COVID test, and a lot of them were.
Lowell, unfortunately, I'm having a very difficult time hearing you. I can't hear anything you're saying. Do you want to try to just maybe turn your volume up or maybe hang up and call back?
Yeah, I will try that.
Okay.
Okay, while Lowell is reconnecting, we'll move on to Hunter Science.
Hey there, Dr. Washington. Thanks for your time today. In regards to, there are several thousand vaccines down in South Carolina that are unused, looking at their data. I know this happened during COVID too, and you clearly said people are coming into Charlotte from various places and also getting vaccinated. What do you tell people who are living here in the county and are on the wait list currently in regards to going across state lines to potentially get it? What is your message on that front?
Sure. I think folks, if they're eligible and they are at risk, I know we are all committed in public health to get them vaccinated as quickly as possible. I know our state partners are working to make sure that we are moving vaccine throughout the state where the demand exists. And I know our federal partners are doing the same. They're making sure that states are using vaccine allocation as it's giving it to them and making sure that vaccine is used before more is made available. I believe those strategies will help us to make sure that we're getting vaccine into the most at-risk communities. But I encourage folks in Mecklenburg, again, to continue to add themselves to the wait list here. As I said earlier, I do believe that we'll offer appointments to everyone on the wait list this week. And so we'll be able to have at least cleared out the 660 that are there. We continue to add folks every day. But we are, especially with the new intradermal method of injection, our supply is much greater than what it has been. And so I definitely think if folks are still waiting and did not get an opportunity to come out and see us over the weekend, certainly hopefully the timetable will be very short. Most people are only on the wait list for a few days right now. And I'm hopeful that we'll be able to shorten that time even in the near future.
A quick follow-up to that, Dr. Washington. Would Mecklenburg County ever ask a state like South Carolina if you all are in need, of course, and they aren't being used down there, to send some of them up in order to help us out up here?
Yeah, I think our first ask would be to the state, and so we want to make sure we check the inventory that's in the state, of course, to ensure that we are maximizing what's been allocated to North Carolina. And again, I am very appreciative to our partners in the CDC for recognizing that we do have a lot of out-of-town guests come in town for Charlotte Pride, and making that additional allocation available to us over the weekend, so we wouldn't have to take that from the supply that we had on hand that was allocated to us for the region. And so I definitely think we would start with the state here locally first to see if there's a supply available in any county or area in the state. But again, as I alluded to earlier, right now I am feeling pretty good about our availability of supply and making sure that we can get through those who are high risk here in Mecklenburg County. And most importantly, we're looking for those folks who may not be on the wait list, who may not be looking for a vaccine, but may be eligible. And that's why we're trying to bring access to the ground.
Step back to Lowell Rose real quick. WBTV, Lowell, were you able to get reconnected?
Yes. Can you hear me?
Yes,
A little bit better,
Is
yeah.
that better? Okay. Sorry about that. My question was more so centered on COVID, and that's a lot of the at-home tests that were sent out by the federal government and by the county. They had a short shelf life of 4 to 6 months and have since expired in July or just expired a few days ago. And I know the FDA has granted an extension. So given that people are going back to school, we're getting back into the cooler season in a few weeks. What do you tell people that may have these tests that it's labeled as expired but has been extended? What do you tell to them? What are some things they should know?
Sure. So certainly this is going to vary by brand, but that information is still going to be any amendments to the shelf life of those individual test products is going to be connected to the lot number that's on the test. Every test has a lot number attached to it, and the manufacturer of that actual product. And FDA does have a listing of those, a notification by product or by manufacturer that you can look up the lot numbers to see if there's been an extension to the shelf life of the product. We also are, if you cannot find it yourself, certainly I encourage people, especially if they received the rapid test kit from the Mecklenburg County Health Department, they should have received an information sheet along with the test that would have given some information about any expirations. But you can certainly call the COVID hotline and they're able to help assist if you have the lot number on the packaging to check and make sure that your product is still viable to be used. We do have adequate supply in the community. Both at the health department and other sites across the county that are available for folks to pick up new tests if your old tests have expired and are no longer usable. So I encourage folks, if they've expired, to go ahead and pick up some more so you can have those on hand as we do head into the next, potentially the next surge in the next several months of COVID.
Just
Next
one follow-up.
question. Go ahead.
I was going
Go
to say,
ahead.
when would you say is the proper time to discard those tests if someone is not even sure about the extended expiration, although it's not listed?
Sure. So Laura, I would always advise folks to not use a product that's expired if you don't have something in writing that suggests that the expiration date is not valid. Or no longer valid or has been extended. And so if you cannot find any evidence that the expiration date has been extended and you are not able to call us to help verify whether or not it's been extended or not, I would advise not to use the product. And again, those expirations are going to be based on the manufacturer of that product. And so you want to make sure that you check by manufacturer and then confirm the lot number. But if you can't confirm anything that it's been extended, then my recommendation would be not to use it.
Next question is Christopher Wiggins, The Advocate magazine.
Hi, Dr. Washington. Thank you for taking my question. From people I spoke with who attended Charlotte Pride Festival Parade, they said that it was difficult to find information about monkeypox vaccines, even though they were seeking it, and that there was a lack of signage except for business card-sized info sheets. On a call with us reporters last week, the White House focused on Charlotte Pride as the start of a pilot program they were rolling out. So I'd like to ask what lessons you may have learned from this weekend's events and what recommendations you'd offer to other localities as they roll out this program at large gatherings. Thank you.
Yeah, Christopher, thanks for the question. So certainly, I believe that we recognize that on Saturday, part of our strategy with the location was to try to make sure that patients felt comfortable in the protection of their confidentiality in terms of being able to get to a site that offered that kind of privacy to patients so that they could actually receive the vaccine. If there was a line, it wouldn't be right in the middle of a festival with 275,000 people. And so we wanted to make sure that we were in close proximity, but not still at a space where we could offer patients that kind of respect and privacy. And so I think on Saturday, certainly we were a little bit further. The same location was a little bit further away because we were along the parade route or close to the parade route. So Sunday we definitely had more foot traffic. And then Saturday, our plan strategically was to have our staff, and they asked me about monkeypox vaccine shirts, sort of walking the crowd. There were staff all throughout the various aspects of the festival space, as well as at our two booths that we had there. And so certainly, I think strategically speaking, it was a solid plan. I think, the convenience of having to walk, several blocks may have been a deterrent for some people. Obviously, we didn't have big banners saying, come here for monkeypox vaccines. Again, trying to offer patients some privacy and making sure that we were respectful to the community and recognizing that we had a very stringent eligibility criteria and everyone at Pride wasn't eligible. So we wanted to make sure that we were clear about who was eligible and our staff were there to answer questions. So I think, could we have had more foot staff available with T-shirts on to answer questions? That certainly could have been the case. But I think in general, what I would say the other jurisdictions who have the big events coming up, it's definitely worth the effort. I think you've got to take the time. You've got to make access as easy as possible. But you also got to take that into account and balance with the fact that we want to be respectful and offer folks privacy when they're receiving medical care.
Thank you.
Next question goes to Claire Donnelly, WFAE.
Hi there. Thanks so much for doing this. Maybe this question is better for Joy. I'm not sure. What do we know about the people who have been hospitalized with monkeypox in the county? Are they all still in the hospital? Were there any underlying conditions? What were they hospitalized with, symptom-wise? Thanks.
Hi, Claire. Thanks for your question. Yeah, so I mentioned that that's very preliminary data. We are coming through and trying to gather some of that information because we're certainly interested in it to help us with our calls with our providers about symptom and medical management. We do know that there are some pain control issues, and that's what I'm clear on right now. We are gathering information about the other areas and aspects. But we do know that a certain percentage of our cases are immunocompromised, and that may be a factor as well.
And then just a quick follow-up. Has the process for getting TPOXX been streamlined at all? Is that helping ease that? I know it's really painful or can be really painful.
Yeah, and that's what we've been hearing during our investigation. So we're collecting information. TPOXX is available pretty readily locally. And so what we're working to do is to advertise that data on our site. So we're collecting information and working with the state to be able to list the sites locally where it's available so that patients can have it available and so that our nurses have it available when they're investigating cases.
Now, just a quick follow-up, Claire. We initially, earlier parts of the outbreak, TPOXX was in very limited supply here in the county. It was only available at one provider for a very short period of time. And so I'm very thankful to our partners at the state and our community partners here on the ground. Many of our HIV PrEP providers, as well as StarMed and Atrium, have jumped on board to assist us with making sure, and as well as I know Nirvana is working as well, to assist us with making sure that there's easy access to treatment for those patients who are eligible. And so that availability has grown, which is certainly good.
Next question goes to Vanessa Rufus, WCNC.
Hello. I wanted to ask two questions. My first one has to do with the case trends as far as what we're seeing growth wise. Not an epidemiologist, but it does seem like the growth of cases has slowed a little bit. Am I imagining that? And if I'm not imagining it, do you attribute that to anything in particular?
Yeah, Vanessa, it's an excellent question, and we balance whether or not we say that, and when is the right time to say it, especially with infectious diseases that you're still sort of working to fight against, and so you don't want to celebrate too quickly. We are seeing though a slowing of the rate of growth in cases here in Mecklenburg County. We certainly are seeing that ourselves. We took a look at our epi curve earlier today, and feel confident that we're seeing some slowing of growth, which is certainly encouraging. And I'm 100% sure that that is at least in part to the work that we're doing here in public health, both in terms of messaging and communications, our disease investigation, the entire team that's happening in communicable disease working to make sure we're identifying those close contacts really quickly, getting those individuals vaccinated. We have a very streamlined process to get them into the clinic very quickly. And then our vaccine efforts. As I alluded to earlier, we've vaccinated over 3,300 people who meet that high-risk criteria or were close contacts here in Mecklenburg County, which is more than some states have vaccinated. So I'm very proud that we're working hard and aggressively to try to address what's happening here. But again, we can't do that in isolation. Monkeypox doesn't know geographic boundaries, and so it will take all of us across the country to really contain the outbreak.
Wonderful, thank you. And then my second question actually has to do with vaccine distribution. Have received a couple viewer questions wanting to know if at any point we would be offering vaccines to a more widespread group other than just concentrating to at risk. Do you foresee that ever happening in the future?
I hope not. And I say that for the reason that if we are successful at controlling the current outbreak and slowing it down completely, then we may not get to the point of necessitating vaccines in the broader community beyond those who are at great risk or have been exposed. But it's not, it's certainly a possibility. So I think that is something that we all need to be prepared for. If the outbreak isn't contained and it spreads further and starts to impact other networks very quickly, or we start to have large outbreaks, then certainly we will need to vaccinate more people and broader groups. Again, the biggest limitation for that has been not that we don't want to vaccinate people who don't want to be vaccinated, is that we don't have enough vaccine available. So again, I can't underscore how important it is that we have been able to pivot to this intradermal administration, which I am so thankful to our nursing staff because that's not a technique that they use very often anymore, since we don't do as many TB skin tests. And so the fact that they were able to pivot, refresh their skills, train last week, and be prepared to deploy that, not just in the clinic setting, but in the community setting, it's just a testament to strong leadership, strong work, dedication, and commitment of the team, and will help us in the long run if we ever got to the place where we had to do more mass scale vaccinations.
Thank you.
Next question goes to Casey Jones, Queen City News.
Hello, thank you. Can you all hear me? It's a little loud in here.
Yeah, I can hear you fine.
Okay. So, school is back in session next week. Are you all concerned about monkeypox spreading to kids at all?
So go ahead, Joy. I can't say anymore.
Yeah, so we have mentioned a couple of times, and thank you for this question. We want to make sure that we reiterate that anybody can get monkeypox. That being said, though, the data and communication and what we're seeing is we don't have a lot of cases in that population. We have, however, convened with some of the school team to make sure there is messaging and communication and an exposure plan in place.
What should school leaders be doing to make sure it doesn't spread?
Our thought at this point is that we want to be able to provide some education to faculty and staff, and also make sure that parents have just some general information about what monkeypox is, how it's spread, and how to prevent it.
And then one last one. Are there any pediatric cases in Mecklenburg County right now?
Yes, there is one case under the age of 18.
Thank you.
Next question goes to Brett Jensen, WBT Radio.
Hi, Dr. Washington. I'm going to ask you the exact same question that was asked to Gibby Harris verbatim after the Georgia Clemson game. Um, and because of the group that is the highest risk from a pure data standpoint, are you in, are you concerned at all? Is the county concerned at all from a potential surge in cases, considering with the the high risk group had the big celebrations this weekend? Are you guys concerned at all that there will be a surge? I want to say an outbreak, but are you concerned about that?
Well, we've already got an outbreak on our hands, but certainly I think we could see increased activity related to the large amount of activity that was happening over the weekend. But certainly, that could happen any given week, and so just depending on what's going on. And so I would just say we're going to continue to monitor the situation very closely. And I would just take an opportunity, a follow on as well to the last question that was asked, is that everyone should just recognize that monkeypox is in Mecklenburg County, and that we should be taking steps to be precautious and preventative. And if you have a rash that's unfamiliar, or cannot be otherwise explained, or it just feels different, or you feel unwell, please get checked, and let your provider determine if you need to get tested. And ultimately, if you're in that high risk group, we want you to get vaccinated because it's really important. We don't want folks to underscore that it's just, body pimples or something like that. We've had a variety of presentations in terms of what that rash looks like. So it's better for folks to see a provider. And the health department is here. So if you're concerned, please come see us. You can quickly come into one of our clinics to get tested, as well as there are numerous sites in the community where folks can go to get checked if you don't have a primary care doctor, which we know can be the case, especially for young people.
And with the follow-up question, let's go back to Hunter Science.
Hey there, I have two quick questions. The latter one, if I could get Michael Cortez to translate into Spanish for us for our Telemundo station, that would be appreciated. But the first one, Dr. Washington, the way that you have, that the county has gone to giving the vaccines this intradermal route, can you talk to us or quantify the impact that's had? In other words, how has that increased, I guess numerically, the amount of vaccines that you've been able to give out?
Sure. So, what the Jynneos vaccine comes in what is traditionally a single dose vial, meaning that there's roughly 5 milliliters or 5 microliters of vaccine in, I think it's milliliters actually, sorry, in each vial. So what the intradermal route allows us to do is to turn that single dose vial into a multi-dose vial, meaning I can vaccinate multiple people from that vial. That then I only have to use a fifth of the dose that I would have used if I were injecting subcutaneously, if I provide the vaccine in the forearm underneath the skin. And so essentially, we have up to 5 times as much vaccine as we would have been previously given. So, for example, just to give you some numbers, last week we received 2,000 doses. And so we would have essentially, if we were only doing subcutaneous, that would be enough to administer vaccine to 2,000 people. Now, with the intradermal route in play, we have the ability to vaccinate up to 10,000, but not exactly 10,000. There are a couple reasons why. The first one is everyone's not eligible for intradermal injections, depending on if they have certain predispositions to certain kinds of skin issues. It's not recommended. And then individuals who are potentially, and then sometimes there's inadequate volume within each single dose vial to be able to fully draw out all 5 doses, and so you may not get the full 5. And so, but it does greatly increase to our available supply by a very significant amount.
I guess so. How many vaccines? A quick follow-up to that question: how many vaccines are available right now using that method?
Sure. And I don't have an update on our existing inventory for today, but certainly I'm happy to follow up with that information after the press conference to find out how many doses we have on hand in the freezers here right now.
Sure. Okay. So for our Telemundo station, can you talk about how the Latino community is being hit here with monkeypox and what efforts you and your office are taking to reach that community, that sub-community?
Oh,
Yes,
wait, I'm sorry. I got the I got the order of who's supposed to talk first mixed up. Joy, you want to go ahead and take that?
Yeah, so I'll start, and Dr. Washington, you can help if you. Um, We are seeing, of course, a majority of the case patients are non-Hispanic, but we have had some cases amongst the Latinx population. And so we are kind of using, I think, some strategies that we have or some tools that we have in place as a result of COVID to get some messaging and communication out to this community and building on those relationships.
Can y'all go into greater detail about the exact outreach?
Sure, Hunter. Let's let Michael translate that for you, and then I'll add a little bit of follow-up. Is that okay?
Sure thing.
Michael Cortez, are you connected? I think we might be having a technical connection issue with Mike. We'll come back to him.
Okay. All right. So Hunter, we'll come back to this question, or do you want me to do the follow-up now? Well, let's just come back to this. There's two other questions, and maybe Michael will be reconnected, and we can redo this. I'm sorry about this.
Yeah, no worries. That's fine.
Next question, we're going to move on to Jenna Contino with the Charlotte Observer.
Hey, can y'all hear me? Hey, thank you guys for doing this. My question is about the hospitalizations. I'm wondering when the first hospitalization occurred and if the sixth is hospitalizations right now or since the start of the outbreak.
So I'll try to share a little bit more. What a lot of that information we've gathered just from a retrospective review, just because these cases, we're following them for so long. And so some of these cases are our initial cases. And our epidemiologist is gathering that information just by reviewing the records.
Okay, next question goes back to Vanessa Rufus. Vanessa.
Thank you. I did want to revisit the schools question, and I guess I'm more curious about whether you've been in contact with CMS about what to do if somebody comes into class presenting with the symptoms. In talking with pediatricians, kind of as you were alluding to, they weren't really concerned that it was going to spread, rampantly in schools, but that maybe classrooms might not know what to do if you have someone who comes into class and they have a strange looking rash and they don't know what it is. So have you walked through any sort of procedures that the district could do? And what do those procedures look like?
I missed part of that question. I'm not sure if that happened for everybody.
Don't worry, I got it, Joy. Yeah. So Vanessa, I think your question's accurate in that we are not concerned about sort of widespread transmission within the K through 12 space. It's certainly that's only as good as we're prepared, right? So we are working with both CMS as well as our other institutions. But also, really critical group that we're convening are the institutions of higher learning, because of course the congregate living on campuses, and I think Joy mentioned earlier that we're convening them to prepare messaging and have additional convenings with them over the next several weeks to ensure that their health teams as well as their operational teams and their student life teams are prepared in the event that there's a case on campus. And so the preparation is happening. And of course, the messaging at the sort of K through 12 level is really more targeted at parents. And obviously, we've prepared our school nurses to ensure they know what to look for in terms of signs and symptoms and how to respond if, in fact, a child presents on campus at a school, K through 12 school, with symptoms consistent with monkeypox. And so there are, again, I will reiterate, while anyone's at risk for monkeypox, specifically those that are not vaccinated, its ability to transmit is a lot more difficult than something like COVID. And so there does need to be that longer term physical contact with someone else that doesn't happen as often in the school setting. It certainly does happen, especially with younger kids. But certainly the activity happening, behaviors happening in this space are such that we should be able to work to contain things more quickly if we do have a child that's either been exposed or has been infected.
And if I could just follow up really quickly to that. So let's just say a child has come into class and a teacher or somebody has noticed that maybe they have a rash or some sort of symptoms that look concerning. Would that child expect to be taken out of class, sent to the school nurse? Would they receive a test on site? I guess, what does that process look like?
Yeah, no, so we're not testing for monkeypox in the school health rooms on site at schools. And we don't want, we don't want teachers to inappropriately misdiagnose a child with something that's not true. And so there are a lot of factors that could go into any given situation if a child presents with symptoms that are similar to monkeypox or just another childhood issue or a skin condition. And so, again, what we're working with in terms of education is making sure that if they do refer the child to the school nurse, that we are able to the school nurse is able to look for the signs and symptoms, obviously talk with the child and the child's family to see if there's any known risk or exposure. But we would not want teachers sort of just, cherry picking students out of class because they see a rash. But certainly we want to make sure that everyone's aware of what the rash could potentially look like. And of course, that's why our school nurses are there to help assist when necessary to make those clinical judgments that we don't want teachers making.
To go back to Hunter Science real quick. Hunter, we have Michael Cortez back online. Do you want to go ahead and ask your question for translation again?
Sure thing. Kind of a two-part on what is it looking like in our Latino Hispanic community when it comes to monkeypox. I know that's not the primary subset or category of people who are getting it, but what is that looking like, and what is the county doing to reach that community too, as far as vaccine messaging?
La pregunta que se está haciendo por parte del señor Hunter es la comunidad hispana, o sea, cómo está impactando esto a la comunidad latina hispana y en cuanto a las vacunas, la disponibilidad de esta. Vamos a esperar la respuesta.
Yeah, so Hunter, thank you for the question. We are working specifically with all of our community partners available. I must remind you that this outbreak currently is having a greater impact on the men who have sex with men, gay and bisexual men here in Mecklenburg County. And so we are working with our partners who are predominantly connected with and serving that community, which includes Hispanic, gay, and bisexual men, to ensure that we're reaching out to those individuals in the community as well. I better stop and let Michael translate.
Thank you. Sí, Hunter, entonces en respuesta a su pregunta, pues estamos trabajando con todos nuestros socios aquí para tratar de mitigar la propagación entonces de la viruela del simio y obviamente pues trabajando junto con estos hombres que son bisexuales o gay, varones hispanos, tratando de mitigar esto y tratando de también comunicarnos con ellos y dejarles saber a ellos toda la información disponible. Gracias. Thank you, Dr. Washington.
Thanks, Michael. And I do want to go back to the school question for a second, just to be clear, because I know there's a lot of comparison just sort of inadvertently in the community to COVID and monkeypox because they're both public health crises that are getting a lot of attention in the community appropriately so. But we know we manage, and Joy's team manages a long list of communicable diseases here in Mecklenburg County that impact schools every school year and on a regular basis. And so I know the COVID response was very public and very, very big in a lot of ways, but how we respond to something like monkeypox is different than how we would respond to COVID for two reasons. One, the nature and the epidemiology of the outbreak today. And then the second one is the risk of transmission and how it's transmitted. The mode of transmission is also different. And so, some folks might be looking for us to have sort of a playbook like we did for COVID for schools, and you don't handle this kind of infectious disease the same way. And we have other infectious diseases, again, that Joy and her team work and track and trace in schools every year. We have a school team in CD that works specifically with the schools as well as the school nurses. So I just want to make sure that's clear to folks as we think about how this is different than our response to COVID.
Okay, next question goes back to Casey Jones, Queen City News.
Hello again. So my question is about vaccines. Is there any vaccines that usually kids in school have that might protect them against monkeypox in any way?
Yeah, Casey. So none of the currently required vaccines for school entry are known as prevention methods for monkeypox.
Thank you.
But I'm going to take a moment of personal privilege and encourage families that despite that, it is really important for folks to get their kids vaccinated headed into the school year, not just because of the exclusion date, but because it isn't the right thing to do. We know we've seen what's happening in some other communities with polio right now. We've seen conversations about measles, and I just want to reemphasize those childhood immunizations are so critical to protecting public health in schools, and the broader community. And so it's just really important to continue to push that message. And we have a back to school clinic this weekend coming up, and I just want to take a moment to say if you have questions, to give us a call. But of course, we will have all of those child immunizations as well as COVID vaccines available for kids this weekend. I think there's a press statement coming out about that probably tomorrow. So more details to come.
Follow-up question for Claire Donnelly, WFAE.
Thanks. Hi again. I'm not sure. Maybe I missed this. I was like a minute late, but how many monkeypox vaccine doses did you all give out at Pride this weekend at all the different events?
Sure. There's a total of 540 over the weekend, and that's of a total of 3,300 total. But 540 over the Charlotte Pride weekend.
And they were all intradermal?
No, they were all intradermal if the patient was eligible to be intradermal. But we switched to intradermal as of Thursday of last week. And so all vaccines are intended to be intradermal unless, of course, there's a contraindication because of the patient's health.
Got it. Thanks.
Circling back to Brett Jensen, WBT Radio.
Hey, thanks.
Brett, I think we lost you.
Sorry, I hit the mute button. Sorry. Sorry if you guys answered this at the very, very beginning when you were giving out your statistical data. But in terms of total cases since the outbreak, was that the 100 and something that you guys gave out, or is that what's currently present?
Joy, you're on mute.
115 cases since the start of the outbreak.
Okay, great. Dr. Washington, I was talking to a very high-ranking official at one of the hospitals earlier this week and over the weekend, actually. And they said one of the biggest concerns, or actually maybe the biggest concern they have, and you mentioned this earlier about colleges and universities starting back up. And he said that so many of the people that currently have infections do not classify themselves as gay or bisexual. They actually classify themselves as heterosexual, even though they're having male to male sex, and that they're worried about this could be a major problem once they get to a college campus and start spreading it more easily with males and females. Is that something that you guys have looked at here locally with, Queens and, UNC Charlotte and stuff like that? Is he right in that is a concern?
So I think on the school front, certainly colleges are an area of concern, and while we prioritize for working with them on preparedness for when students are coming back over the next week or so, certainly, and I think I there are people in the community who don't identify, men who have sex with men who don't identify as gay or bisexual, which is why we continue to use those terms, all three interchangeably, to make sure that we're communicating as clearly as possible without, of course, adding to stigma about who is at greatest risk, and are trying to make sure we're creating safe space for all of our residents to feel comfortable